He tilted the phone a little bit. Hello, I'm Dr. Bryan DiMarco at Renew Dental. We get a lot of questions in our office about what is cosmetic dentistry. So I'm here today to answer a few of the most common questions and hopefully give you a better understanding of what cosmetic dentistry is.
What is cosmetic dentistry?
So the main question that we get from patients is, what is cosmetic dentistry? Cosmetic dentistry kind of involves a wide branch of dental treatments, but basically they're anything that helps to improve the aesthetics of your teeth. So some of the procedures that we have, kind of starting with the simplest, would be something as simple as just doing some tooth whitening to get your smile a bit brighter and whiter. From there, if that wasn't enough, we can look at doing some dental bonding. So that's adding some filling material to the front teeth to improve their shape and potentially the shade of the teeth. From there, our other options would include doing some veneers. So those are typically either going to be the filling material that covers more of the surface of the tooth, or a porcelain veneer, which gives you that kind of high aesthetic look. If the teeth are more broken down, we can look at doing a crown or two on them. And then the last option, or one of the main options, is looking at getting braces or Invisalign done to help us line the teeth up better so that you have a nice, beautiful smile.
How would I know if cosmetic dentistry is right for me or my family?
So we often get asked, how do I know if cosmetic dentistry is going to be right for me as the patient or potentially any of my family members? The easiest way for us to do that is to get you in for a dental exam. What we'll do at that exam is take some x-rays of your teeth. We'll take some photos. Sometimes we'll even take a 3D digital scan. We'll see how your teeth are lining up and what you kind of want to improve with your smile. And then together we can come up with an individualized plan for you to best fix your smile how you would like.
What's the difference between cosmetic dentistry and general dentistry?
So the main difference between cosmetic dentistry and general dentistry is cosmetic dentistry deals more with the aesthetics and the looks of the teeth, whereas general dentistry is more about keeping your teeth healthy and your oral health good long term. So general dentistry usually involves, doing fillings on the teeth, root canals, extractions, things like that, where we're trying to treat any oral disease in your mouth.
What is the difference between cosmetic dentistry and restorative dentistry?
So the difference between cosmetic dentistry and restorative dentistry, they're pretty similar, but restorative dentistry basically means that we're restoring your teeth because they have things like cavities or cracks in them and they're unhealthy, and we're removing that unhealthy part of the tooth and fixing it with a filling or a crown. Whereas with cosmetic dentistry, we still may be doing fillings and crowns, but the main reason we're doing them is because of the looks and the aesthetics of the teeth.
How can cosmetic dentists fix my teeth?
I answered that already, I guess.
Okay.
Well, I guess they can edit it how they want to. So patients will also ask, how can cosmetic dentists fix my teeth? So there are a wide range of treatments available, from whitening to dental bonding to veneers to crowns to orthodontic treatment. It really just depends on you as the patient and what situation you're currently in and where you want to end up, and then we come up with a treatment plan from there.
Can cosmetic dentistry improve my smile?
Cosmetic dentistry can definitely improve your smile. That's kind of the main goal of it for us, is that we want you to be happy and confident with the smile that you have, so you can go out there and live your life as best as possible.
Can cosmetic dentistry fix an overbite?
So patients will ask if cosmetic dentistry can fix an overbite. So generally, if overbite was the only concern, then we would look to send you to an orthodontist. No, sorry. Yeah. So some patients ask us if cosmetic dentistry can fix an overbite. It generally depends on how severe that overbite is. Usually the main fix for an overbite is getting orthodontic treatment done, like braces or Invisalign. But again, it depends on your individual situation. We would do an assessment and go from there.
Can a cosmetic dentist fix crooked teeth?
Patients will also ask if cosmetic dentists can fix crooked teeth. Again, this depends on the scenario. If we have some minor tilting or shifting or minor crowding, yes, that can be compared. That can be fixed sometimes with simple fillings or veneers. If we get into a situation where things are really crowded or crooked, then that's usually when getting orthodontic treatment done first will help to straighten things out, and then we can do the final restorative procedures like the dental bonding or the veneers to get things looking perfect.
How old should a child be before considering cosmetic dentistry?
Some parents will ask us how old should a child be before considering cosmetic dentistry. In my opinion, I would definitely like to wait until that child is at least 18 years old, sometimes even a little bit later, so that we can see how the teeth have come in, how the gums have kind of changed over time, because your mouth is changing into your early 20s. The main thing for cosmetic dentistry is we don't want to do anything too early where we're destroying your natural teeth or hurting the surface of them, and then we have to look at replacing fillings over time. I think it's always best to be more conservative. We can look at doing some whitening, for example, and that's something that doesn't damage your teeth and doesn't require you have to do it every so often to fix it.
Can a cosmetic dentist work with young children?
So parents will ask if a cosmetic dentist can work with young children. Usually with young children, we don't do too many cosmetic procedures for them. The reason for that is that they're losing their baby teeth, which don't require that. If they're in their adult teeth and there is some crowding that's going on, definitely getting some orthodontic treatment, some Invisalign or braces, typically around the ages of 10 to 12, can be done to help improve the aesthetics of their smile. But I definitely wouldn't look to do anything like veneers. That's just too invasive at that point, and we would want to wait until they're an adult if they are unhappy with the way things are looking.
Is there any point where someone is too old or not well enough for cosmetic dentistry?
I don't like that question.
Okay.
Or too old. Okay. Some patients will ask, is there a point where I'm just too old to get cosmetic treatment done? Again, this kind of applies to the individual. I would say if you want to improve the look of your smile and it's something that bothers you, then I don't think at any age you're too old to get cosmetic treatment done. The truth of it is none of us really know when we are going to die. So the main thing is that we want you happy while you're living. I don't know if that was weird.
Did you already do that?
Yeah. Did you pause it? So patients will sometimes ask, am I too old to get cosmetic dentistry done? In my opinion, I feel like we're never too old to improve something about ourselves. If you're really unhappy with the way that your smile is looking and you want to kind of look at improving that for yourself, there are procedures that we can do that are not as invasive or not as complex that can help to improve your smile so that you're confident about it for the rest of your life.
What other conditions can be fixed with cosmetic dentistry?
So sometimes patients ask us if other procedures. Sometimes patients will ask us if other problems can be solved by cosmetic dentistry. It definitely depends on what problem is going on. But for example, if we were doing some crowns on the front teeth and you had an issue with there was a bit of a cavity going on, or the tooth was at risk of breaking in the future, then yes, that dental crown not only will help the look of your tooth, but also help to fix that disease and keep it strong long term.
How can cosmetic dentistry change the structure of my mouth?
So patients sometimes will also ask, how can cosmetic dentistry change the structure of my mouth? So this kind of really depends on what procedures are being done. a big way that the structure of your mouth can be changed is through orthodontic treatment. Not only the benefits of getting things lined up straight and looking good, but also if you have a proper bite, that's going to allow your teeth to last longer and be protected so that they hopefully don't break or crack on you in the future.
When would cosmetic dentistry be considered oral surgery?
Oh, wouldn't? I don't know. Yeah, I think.
We're about halfway. What are the advantages and benefits of cosmetic dentistry?
So some of the advantages and benefits of cosmetic dentistry are obviously it helps to improve the look of your smile. So typically it helps patients with their self-confidence, makes them want to smile more, which is obviously really important for, day-to-day communication. I think that's kind of the beauty of cosmetic dentistry is that we can just help people give them their smile back so that they feel good about going out and going, meeting their friends and their family and doing certain activities.
What is the process I can expect to go through if I get cosmetic dentistry?
So the process that you can expect to go through if you decide to do cosmetic dentistry is first that we'll start off with an exam and some records so that we really figure out what treatments are needed to get you the result that you're looking for. From there, depending on what treatments that we need, it does vary quite a bit, but we will go through kind of how many appointments we plan to do, when you can expect your new smile, and everything like that.
What should I consider when choosing a dentist for cosmetic dentistry?
Sometimes patients will ask what they should consider when looking for a dentist who does cosmetic dentistry. I think the main thing is just finding somebody that you're comfortable with because you are going to be seeing them for a few appointments. You want to make sure that you're on the same page so that you can get the result that you need.
What anesthesia options would be available during a cosmetic dental procedure?
So sometimes patients will ask us what anesthesia options will be available during their cosmetic dental procedure. Again, this really depends on what type of procedure we're doing. If we're doing something as simple as whitening, then yes, there's no need obviously for you to be numb. If we're doing something more invasive, like we have to do a crown, then yes, we would give you a bit of numbing so that you are comfortable during the procedure. We don't want you kind of sitting there having pain. It makes the whole appointment more enjoyable for everybody if you are comfortable. These questions suck. I don't know. Yeah. So I hope I was able to answer a few of your questions today on cosmetic dentistry. If you do have any other questions or would like more information, or if you are ready to take action and book your appointment, please feel free to give us a call at 204-259-3804.